I'm Forrest Jessup. I'm a graduate student at the Center for Environmental Health Sciences, part of the University of Montana. CHS provides an excellent opportunity to present our research and research that is going on currently in society to our peers, and we do that as graduate students in our journal club. And this is a graduate student only journal club, and that's to support interaction between graduate students. It gives us professional development, the practice necessary to present our research and others' research to each other, which is a critical process in the sciences, and to the public, to the general public. So the focus of my research is on chronic inflammation, and chronic inflammation has been implicated in the development of many chronic diseases, including pulmonary fibrosis. I am currently doing research trying to understand the role of autophagy in chronic inflammatory diseases, including silicosis, sarcoidosis, and other particle-induced lung diseases. I was recently awarded a fellowship on investigating the role of autophagy in silicosis and sarcoidosis through the Pharma Foundation. This is a highly competitive fellowship. Only about 8 are awarded nationally a year, and I was fortunate to be one of those 8 this last year. It provides $20,000 a year in stipend support towards my dissertation research, and is great for professional development. So my research and the center has provided many opportunities to travel to different meetings. I've been able to go to Hawaii, in New York, and I've been able to present my research at 2 different SOT meetings, one in San Antonio and one in Phoenix, Arizona. This is their annual international meeting. At those meetings, I'm able to establish collaborations, fulfill officer positions, and get my research out there, which is very critical to a graduate student's professional development and success.
My name is Kevin Trout, and I'm a biomedical sciences PhD student in the Center for Environmental Health Sciences. I study the foreign body inflammatory response to implantable medical devices. Particularly, I focus on macrophage biology. My goal of my research is to improve the performance and safety of medical devices. A couple examples of medical devices would be hip implants or meshes for hernia repair. My research interests led me to become more involved at the national level by joining the Society of Toxicology, where I serve as the Medical Device and Combination Products Specialty Section Graduate Student Representative. Also, I serve on the Graduate Student Leadership Committee of the Society of Toxicology. Here at the University of Montana, I've been quite involved in the CEHS Summer Undergraduate Research Program. Some examples of my involvement include being a research mentor, teaching workshops, or even organizing activities for the students, as many of them it's their first time coming to Montana. Mentoring students has been a valuable learning experience for me. Also, it's very rewarding to see how well the students do and their success after completion of the program. For example, one of my students went on to the Biomedical Engineering Society National Conference in Seattle, Washington, where she did a great job presenting our work. Other conferences I've attended include the National Institute of Environmental Health Sciences Centers for Nanotechnology Health Implications Research Consortium meeting, which was in North Carolina, and the Western Regional IDEA Conference, which was in Hawaii. The IDEA Conference was for participants in the Institutional Development Award, Networks of Biomedical Research Excellence, and Centers of Biomedical Research Excellence programs. One of the best parts about doing research in CEHS is the expertise of the staff and the core facilities. The core facilities staff are very flexible and willing to help you out with your work.
My name is Luke Montrose. I'm a fifth-year toxicology graduate student in the Center for Environmental Health Sciences, and I'm originally from London, Ohio, which is a small farming community southwest of Columbus, Ohio. In the center and in this department, as a graduate student, we all have the opportunity to participate in a number of different organizations and societies, and probably the two that most people are most actively engaged in are the Air and Waste Management Association and the Society for Toxicology. The Air and Waste Management Association, or ANWMA, is a neutral forum for exchange of information. So people from around the United States, and especially here in the Northwest, come together for annual conferences and specialty conferences to exchange information. And one of the most recent conferences was actually a specialty conference held here on the University of Montana campus, which involved in disseminating information and successes and failures on policies and procedures for reducing wood smoke emissions. I've been the vice president and the president at the local level, and I got to be the president of the state chapter of AWMA and hold meetings that brings together, even though we're a large state, we oftentimes have quarterly meetings that are either held by teleconference, or we try to meet in a central location like Butte or Helena or Missoula. Here at the local level on campus, we have the University of Montana chapter of AWMA, and we meet regularly. At those meetings, we really engage students. Through that, we give them the opportunity to sort of drive what we talk about at the meetings. We talk about current issues, and we discuss bringing in speakers that are of interest to the entire group. The Center for Environmental Health Sciences has given me the opportunity to present a lot of data outside of the University of Montana, and I've recently gone to San Francisco, California, Whitefish, Montana, Seattle, Washington, and been able to present information, disseminate the data that I've been able to collect as part of my dissertation. I've been involved in several different studies that have taken me outside of just the University of Montana campus to do field work, and two of those studies that were really awesome were a study looking at the rates of respiratory infections and asthma in children under 18 that were Alaskan natives. So we specifically targeted Yupik Eskimo population and the Athabaskan Indian population, and had the opportunity to actually participate in field work in those communities, sort of at the door-to-door level, passing out surveys and actually working inside the home of these people. And so that took me to Alaska 4 or 5 times, and I got to meet a lot of different people from those two communities, and experiences that I won't forget.